introduce our guests. First, we have Kim Trent. Kim is the Deputy Director for Prosperity for the Michigan Department of Labor and Economic Opportunity. In the position, Kim is charged with guiding and building support for efforts to boost the economic security of Michigan citizens through strategic initiatives, programming, and partnerships. Her portfolio of leadership duties in state government includes serving as the key staff member to the Michigan Poverty Task Force. Kim's career has included leadership roles on the staff of former Congresswoman Carolyn Cheeks Kilpatrick, U.S. Senator Debbie Stabenow, and former Michigan Governor Jennifer Granholm. For 7 years, she held various key staff positions at Michigan Future, Inc., a think tank dedicated to boosting prosperity in Michigan. She also served as an elected member of the Wayne State University Board of Governors from 2013 to 2019. Welcome, Kim.
Thank you so much, Ben.
Also with us this morning is Gilda Jacobs, President and CEO of the Michigan League for Public Policy. Gilda has served in that role with the League since 2011, following a 30-year career in public service at the local, county, and state levels. Gilda served in the state Senate for 8 years after serving 2 terms in the Michigan House of Representatives, where she made history as the first woman floor leader in either chamber of the legislature. Prior to serving in the legislature, she served as Oakland County Commissioner and a Huntington Woods City Commissioner. Thank you for joining us, Gilda.
Thank you.
And we also have Nancy Lindman, the Director of Public Policy and Partnerships for the Michigan Association of United Ways. Nancy manages the Michigan Association of United Ways impact work, engaging local United Ways and statewide partnership projects and advocacy. Before joining the Michigan Association of United Ways, Nancy carried out community outreach efforts for Michigan State University's Institute for Children, Youth, and Families. Nancy joined the nonprofit sector following a career with IBM in the training and organizational development arena. So thank you for being with us this morning, Nancy.
Thank you, Ben.
So today we're hosting a discussion about barriers to employment as identified by the Michigan Association of United Ways ALICE project. ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed, and it represents those in our communities who are working yet still struggling to make ends meet. The 6 barriers identified within the ALICE project to employment that this population faces includes housing, childcare, food, technology, healthcare, and transportation. So we're going to start off the discussion today with a question for Nancy. So please tell us about the importance of the ALICE project and what is the impact of the COVID-19 crisis on the ALICE population to Michigan residents?
Sure. Thanks, Ben. Happy to. ALICE is very important to us at United Way because it just helps us to better understand how people in our communities are doing. So I would guess, much like your network, it's important for us to know the extent to which families are struggling, where their struggles lie, in order for a whole community to do well. So ALICE is extremely important to us because it's providing a very concrete metric on what it actually costs to live county by county across the state. We all know that the federal poverty level as a metric is sorely outdated. According to it, a family of 4 should be able to make ends meet for $25,000 a year. And we know through really looking at what does it take to cover the very, very basics, that if you are a household with a couple little ones in childcare, that the budget, or just the survival budget, would need to be $61,000 a year. So a real gap there. And so this is a framework that is really helping us understand how communities are doing. And more importantly, it's helping partner organizations understand the real magnitude of need. As we know, before COVID, 43% of Michigan's households were below what we call the ALICE threshold, or what it takes to cover those very, very basics. We also know that COVID has been very impactful in terms of those households. Many of our ALICE households are working within the service sector. And so we know that this number is much higher, has been much higher because of COVID. when we talk about those barriers to employment, we look at each one of these budget line items. We'll talk about housing, for example. We know it's going to vary by community, right? It's going to cost more for someone in Ann Arbor than it might be in Escanaba for housing. So Alice might be choosing to live where housing costs is lower, but that may well impact their transportation costs with the employment being further away. So these barriers to work, we know are complicated, they're interwoven. And we know that the solutions, if they're to be effective, need to be comprehensive and interwoven as well, which is why, we just find the Alice partnership with Michigan Works so important. You all take a holistic approach. That for that Alice household, a job isn't enough. There are these other needs, these other barriers. And I would just like to also hold up the work that MDHHS has done with My Bridges, a one-stop shop for all benefits, one-stop shop for connecting with community resources through that 211 database. These are a couple tools. This is infrastructure that we have in place that we think is very important in order to systemically address that over 40% of our households are below that Alice threshold, and way more than that these days. So let's take a look, as you ask, just very quickly, the barriers one at a time. Housing. We all know that housing is a cornerstone to stability. But unless you're paying for childcare, it's the most expensive item in that household budget. So it's a tough metric to move without some sturdy supports for those Alice households. Employers know that without safe, affordable housing, families just can't maintain that stability, show up at work. Kids aren't going to do well at school. So today, we see this cliff coming in terms of housing, particularly with COVID, the health and economic crisis. And there's a great concern around evictions. We're grateful for the state's eviction diversion efforts, and we know that additional supports in this very key area of housing is going to be needed for us to survive this crisis. Childcare is, for those families I had mentioned with kids in childcare, the most expensive budget line item. It's also a real critical line item because education is so important. It's such a predictor of financial well-being for Michigan families long term. So with child care, we know there's this immediate workforce need for folks to be back at work. We need that child care well in place, but there's also that long-term return on public investment for child care. We see the effects of that spilling over to K-12, how well our kids are doing through high school. And as you know, doing well there is just critical for secondary education and job advancement. So it's, like I said, all interconnected. We know that there have been some real challenges for many childcare providers, most of whom are Alice, as well as for a childcare system. I would just say that I think the department has done amazing work in partnership with childcare networks. Michelle has just really helped us come together in this childcare area to do as well as we can in creating that access for essential workers, as well as helping those childcare providers stay in business, which is going to be very, very important for businesses to open. Moving along here, we know food is the most basic of all needs. And here's where a healthy diet, fueling our Alice household, going to work, learning well, is really critical. And we also know that food is one of those short-term, easy places to skimp on costs. So that's where really boosting our SNAP and some of these fabulous programs that are coupling healthy food with that SNAP benefit can really benefit Alice households, and whether it's school or work. I'd mentioned housing costs driving much of the cost of transportation for Alice households. We know public transportation is cheaper than owning a vehicle, but in Michigan, of course, it's not available in that many of our communities. So owning a car, which is one of the few assets Alice is likely having if Alice is working, is a depreciating asset. And it's one of those essentials that isn't really adding to the long-term asset within the Alice budget. Healthcare is certainly one of the, key budget items. It's one of the hardest budget items to really predict or to budget, and there are huge consequences if that healthcare access is not in place in terms of household financial stability. Healthy Michigan has been a big win. It is critical, and having that building block in place is really key community by community. As you know, technology was a new line item for Alice that was added in the 2017 report. The cost for technology is for a very basic cell phone. I would say in COVID time, we're seeing that access to technology is really critical, certainly for education and likely for some employment, even more than that basic cell phone. So that line item is probably way under budget during these particular times. So Ben, in wrapping up, we kind of ticked through those barriers, but I'm going to add one more critical expense within the Alice household, and that's taxes. I would just like to say that the smartest, most effective policy action we could take in Michigan for Alice is to expand that earned income tax credit. We know that could work for us.
Thank you so much, Nancy. We appreciate all the work that you do to educate people on Alice, and I think you did a great job of describing how those barriers are all interconnected. So thank you again. So now we're going to turn to Kim Trent to talk about the Michigan Poverty Task Force. So Governor Whitmer created the Michigan Poverty Task Force to ensure that the state government is bringing the full force of its efforts and resources to the fight against poverty. So as the key staffer on the Michigan Poverty Task Force, what role do you see the task force playing as the economy begins to recover following the COVID-19 crisis?
Thanks for that question, Ben. I want to also just acknowledge both of my co-panelists because as we are framing our work on this front, we are very much using the Alice poverty rate rather than the federal poverty rate, because we realize if we're really going to have an impact, we have to talk about people who aren't able to make ends meet. I mean, it cannot just be the people who are barely subsisting. And so we recognize and have framed everything that we do around the Alice rate. So we want to just thank United Way for giving us that framework. And then obviously one of the first calls I made when I got this job was to Gilda Jacobs, because I recognized the importance of the work of her organization. And they actually gave us some great ideas that we have now put on our agenda. We are working, we're still developing the agenda. We're at the stage now where we're actually going to external stakeholders to talk about the things that we have listed on the agenda. We're doing that deep dive of research to kind of look at what other states are doing, how they've been able to implement some of the ideas. And we're hoping to get more ideas from external stakeholders. So I'm really happy to be here today because I know that the folks who are on this teleconference are very familiar with a lot of the issues that we'll talk about today. So as you mentioned, the governor did issue an executive order in December creating the Poverty Task Force. I started in mid-January and then COVID happened in March. So it's been quite a ride. I think no one will be surprised that the work that we do at the Poverty Task Force really a lot of the issues that we're talking about there have been laid bare by COVID-19. There's no way you can ignore things like income inequality and the lack of a infrastructure as it relates to a safety net for our citizens who rely on one in the wake of COVID-19, which has kind of made it so obvious for everyone. So, a lot of what Nancy talked about just now. We completely are aligned with the thinking there and are trying to really come up with some strategies to change kind of the long-term infrastructure for the state. But we recognize it's not going to be an easy lift. But I think that this crisis has made the work that we do even more important than ever. What we have done with the Poverty Task Force is break into 4 work groups. We call them Safe and Secure, which is our work group that deals with basic needs, Strong Beginnings, which deals with childhood poverty, Removing Barriers to Economic Mobility, which is very much about what we're talking about in today's meeting, and Providing Opportunity, which is our long range kind of ideas to help people really transcend generational poverty in a meaningful way. So we're giving them the tools to be able to really transcend poverty. So even in our work groups, we have issue groups that are looking at specific elements of those work groups. So one is when we talk about removing barriers to economic opportunity, we recognize that criminal justice is a really important element of that. And so we are working with a subgroup with members of, and I should mention that the Poverty Task Force is made up of 19 state departments. And I think that's important to mention because, as Nancy said, there's so much interconnectedness in all of this work. Poverty does not just exist in silos. We have a number of different initiatives that really are going to require collaboration between our departments. And so we're there to be that kind of glue that brings together departments so that they are effectively coming up with both policies and better implementing the ones that we already have in place. And so some of the ideas that we have talked about are making strides to help ease some of the barriers that exist, particularly for returning citizens, for people who have low-level traffic violations and those kind of things that are preventing them from really entering the workforce in a meaningful way, automating benefits for people who are returning or for their families that are left behind when they are beginning incarceration. Those are the kind of things that we're looking at in the criminal justice subgroup of that. When we're also talking about removing barriers, we're talking about things like expanding TANF and really leveraging TANF the way that TANF should be used. We all recognize, I think most of us on this call particularly recognize, that there have been a lot of diversions of the original kind of intent for TANF. And so we want to kind of get back to that original purpose, which was to provide support to people who really need it, who really need those cash benefits. So really trying to figure out how we can change, obviously that's a legislative change that has to be made, how we can get the momentum to have that conversation in a meaningful way. We also have a work group that we call Providing Opportunity, which is, again, kind of more of the long range. And on that front, probably the signature program and the one that Leo itself is probably the most engaged in at this point, or has the most skin in the game, is our 60 by 30 initiative, which is designed to get 60% of Michigan's workforce a post-secondary credential by the year 2030. 60 by 30 in a lot of ways sort of mirrors some programs that have really moved the needle in states like Tennessee, but with a unique Michigan spin, recognizing what our history, our heritage, our barriers, our issues. So we're trying to be very creative in trying to figure out how we can get a workforce that is nimble, that is recession-proof, that is going to be able to hold on to jobs as the economy evolves with the introduction of machines. We recognize that, before I worked here, I worked for Michigan Future. Lou Glazer has been ringing that bell for a long time about how we need to pay attention to how the jobs are changing, and we need to make sure that our workforce is ready for that. So those 2 work groups are the ones that I think are most engaged in the work you're talking about today. Obviously, when you talk about those 6 categories, housing is a part of Leo. So Mishta is a part of our family. And as Nancy mentioned before, DHHS, I think, has done an excellent job during this crisis, but they're being tested every day. I think there's a lot of innovation that's being created in MDHHS, and we are working very closely with them. In fact, the original design of the Poverty Task Force was that MDHHS and Leo would work collaboratively because, you know, they have such a stake in this work. And so when you, MDOT, transportation is obviously one of the things that you're looking at. So we are very much taking a multidisciplinary look at how we can move the needle on poverty with those long-term policy changes that we're trying to make through the Poverty Task Force. And our goal is to have a document on the governor's desk by the end of this year. We also have some short-term strategies that I want to briefly tell you about because I know that I'm already over my 5 minutes that I was allotted. So, but just briefly, I want to talk to you about Skills to Work, which is a new digital hub that we introduced that has information about online learning opportunities. We worked in collaboration with the Michigan Community College Association and with Michigan Works to create a return to work playbook that's available on that digital hub. Also with those learning opportunities at community colleges, so that if people want to return to work while the economy is trying to power back up, if they want to improve their opportunity, their chances of getting jobs and being able to keep jobs, we want them to take advantage of that through our Skills to Work hub. And then also Futures for Frontliners, which I think a lot of you are familiar with, which is an initiative to really reward. I mean, we know after World War II, or you know, we decided that those people who put their lives on the line to protect our democracy deserve to be rewarded with opportunities to be able to buy housing and to be able to go to college. And so we here in the state of Michigan, recognizing that our goal is to get 60% of our workforce a post-secondary credential, thought that this would be a really appropriate way to express our thanks to those men and women who have been sacrificing by serving on the front lines of this pandemic in roles, in all kinds of roles, from stocking grocery shelves to working in hospitals, you know, cleaning hospitals. And there are just a lot of people who could not take the time off and are still working with the public. And to show our gratitude, we want them to be able to have that access to career and social and economic mobility. And that's why we have Futures for Frontliners. We're still standing up the program. Our goal is to have something that we can announce that's going to be really concrete by the end of this month. So by Labor Day is the goal that we're looking at. So those are just a few of the ways that we are really trying to be responsive, both in this crisis and in the future, so that we can have a stronger economy and a better trained workforce. And I thank you so much for giving me 10 minutes, about 5 minutes overdue, to talk about some of the things that we're doing here with the Poverty Task Force. Thank you.
Yeah, thank you, Kim. That was very helpful. We appreciate the update in terms of where the task force is at. And just as you mentioned, those subgroup topics, I mean, they're all so relevant to the work that we do each day. And also thank you for talking about the Future for Frontliners. We're ready to assist however we can at Michigan Works with implementation of that program.
Thank you so much.
Turn over to Gilda. As we look at the 6 barriers to employment identified by the ALICE project, it's important that we look at those barriers through a racial equity lens. So until we remove the racist barriers that have been built over time, the people in Michigan cannot thrive. So tell us about the League's work regarding equity and inclusion, as well as the importance of the League's 21-day racial equity challenge.
Okay, thanks, Ben. And just a shout out to Michigan Works and my co-panelists. You guys are doing amazing work every day. It's wonderful to be able to partner with you on so many of these issues that we've all been working on for a very long time. That's really now really in the forefront. So to give you kind of just a perspective of the League, we've been around for 108 years. That's a long time. So many of the issues that we're working on today were issues that we were working on 108 years ago. And you know, as we kind of take a look at the League's work, you know, we've seen that we've been concerned about about economically vulnerable populations and their kids since day one. In fact, we started out working on labor laws for kids, so many years ago. And the social workers that started the league said, we have to figure out a way to impact public policy, to change public policy. So we've been really working at these issues for a very long time. We realized a few years ago that we really needed to apply a racial equity lens to all of our work, our internal work and our external work. And because so much of what we're dealing with now is systemic racism that has been a part of public policy, both at the state and at the federal level. And the chickens are coming home to roost, because now we see what happens when you don't address these really important issues. So if we're going to really look at and hope to achieve economic security for all people in Michigan, one, we need to understand the origins, how it influences individuals, how it influences organizations, and how it influences what happens in our government and in public policy. So one of the things that the League started a few years ago, it's called our EDIT team. EDIT stands for Equity, Diversity, and Inclusion Team. And this group of staffers who are totally committed to this have been working very carefully to change things in terms of how the League promotes our work, does our work, and also our internal work. And they've been really important. This group has been really important to helping us make sure that we can further achieve our mission in a time when we all know that we really need to have a comprehensive focus on equity. So we had a staff member that came up with an idea of a 21-day racial equity challenge. And she put together, with the EDIT team, a very amazing tool that individuals and organizations can use to kind of really take a deep dive in terms of how they personally see and handle and deal with racial equity. And, we know that it takes about 3 weeks to change a habit, and that's why we ended up coming up with, with a 21-day challenge, which, by the way, folks can either Google 21-day challenge Michigan League for Public Policy, or go on our website, www.mlpp.org, and you can access it. And it can either be self-guided, or we do have some guided opportunities to do this with a staffer. And what it does is it really, as I said, helps to really deepen an individual's personal understanding. So every day there's a little work to do. It can be a lot of work or a little work, depending on what everybody wants to do. There's a reading or a reflection or an ability to sit and write or journal, and it's all done personal. It doesn't have to be shared with thousands of other people that are doing this, but it's really a great way for people to personally reflect on racial justice and their own ability to change, make changes, and be part of really a social change and a social movement. And understand this is a process. We've been at the League going through the process of building in and using a racial equity lens on all of our work for years, and this is a long journey, and we are nowhere near there. And we kind of think we're some of the experts in this area. So the point of this challenge is to every day make it a habit of doing something to broaden an individual's perspective, identify topics for deeper learning, and then to better equip ourselves to combat white supremacy. And interestingly enough, when the League was started 108 years ago, it was built on white supremacy platform, and understand that's an academic term. I know when some people hear white supremacy, automatically they may see you know, the Ku Klux Klan marching down, 12 Mile in Berkeley, Michigan. That's not what we're talking about. It's a real academic term that people shouldn't be afraid to use when we're having this this conversation. So we've had a lot of people and a lot of groups that have really embraced this. We have over 3,000 people who have already taken the challenge, and our partners and friends in 45 states have actually started to use our 21-day challenge, and even people in Denmark and Peru have actually used this. So that's pretty exciting. And there's just one thing that we've Nancy did a great job of really framing these ALICE areas. What I want to do is leave my part by giving some very specific data about inequities in our state, because I think we need to really understand this. So, these numbers are actually a couple of years old. Honestly, I think because of COVID, they've gotten worse. But the unemployment rate for African Americans is 9.5%, Latinx workers 6.9%, and white workers were at 3.8%. That's 2017 data. So right then and there, we can see the huge inequities within different groups. Median wages for African Americans, $14.68, Latinx, $14.41. These are much less, it's much less money, much lower than those of white workers at an average of $19.20. And that's using 2016 data. Again, it's worse now if we were able to take that snapshot. And it's important that if we're really going to achieve racial equity, we have to change those numbers. These numbers are they're bad, and they can be corrected. So that's what she wrote.
Thank you, Gilda. Yeah, I think it's important that we, have those key indicators where we're always looking at the data and where we're at, because there's significant improvement needs to be made with those. And congratulations on the 21-day challenge and its widespread implementation. That's great to hear. So this next question is going to be for the entire panel. And let's stay with the same order. So we'll start with Nancy and then Kim and Gilda. But looking at everything that's happened over the past few months, from the global pandemic to nationwide racial strife, to record unemployment, to the shutting down of the economy, we're clearly at an inflection point. How have these events impacted each of you in the way that you'll approach things, both personally and professionally, in moving forward?
Yeah. Well, these events have rocked our world at United Way. There has been a huge pivot from business as usual to emergency response. Nothing compared to what's needed, nothing compared to the public investment, but well over $35 million into local communities for the purpose of COVID relief. Our systems, our United Ways are very, very focused on now how do we move to looking at stabilizing. We think we're in this for the long term. When we first came out with My Bridges, first came out with ALICE, it was just after we were, recession. And we remember that time, and it's a long, slow climb. United Ways are really pivoting the way in which they're looking at their work. Just last week, a decision has been made so that every United Way is looking very specifically through this equity lens with a declaration statement, looking in terms of training internally and with our boards. We're a 100-year-old organization too, and I would have to say we're probably part of the problem. You're not 100 years old with all of our community partners, all of our corporate partners. It's there, it's built in. And so the third stake in the ground in terms of really addressing this is a requirement in terms of how we do business, how grants are made. And it is a sign off in order for membership to be using this equity lens in partnership with those in our community. We know that these issues are systemic. We're not going to get on the other side without doing just what Gilda is describing. So call it confluence. I think that these huge challenges, at the same time that we have this awareness in many corners where there hasn't been as much awareness, I think is an opportunity for us. I think as much as anything, United Ways are realizing can't lift this one by ourselves by any stretch. And so renewed efforts around, again, much of what the League has always done so very well around policy. How can we do things in a more collective fashion? And so our local United Ways are moving, away from siloed funding to funding that is collaborative funding, and a lot of work ahead, but I think some real opportunities for those local communities to come together and make a difference. We're also looking forward to our next ALICE report coming out in 21 March, and that will continue to be our guide in terms of that integrative approach.
Thank you, Nancy. Kim?
So, obviously, when you talk about the establishment of a poverty task, well, first I should say that the state of Michigan has been around even longer than the two institutions. We're looking at about 183 years of existence. And certainly, a lot of the factors that you talked about with, white supremacy being a foundation to how we operate. I mean, those things are also very much a part of state government. I mean, I think that in addition to the work that I'm doing with the Poverty Task Force, just in the last couple of weeks, I was appointed the Equity and Inclusion Officer for Leo because I didn't have enough on my plate. But I'm not complaining because I'm actually really passionate about that work, very much so. And I think that I feel a special obligation to be brave in having and trying to cultivate conversations that are uncomfortable so that we can not only, because I think a lot of times when you talk about organizations and you're talking about things like equity and inclusion, people pivot or kind of default into thinking about HR issues and, the culture of the institution, which is important. But because we touch so much policy and so many Michiganders, and because of the foundation of how state, local, and federal law has, in many ways, really undergirded kind of the structural racism, the spatial racism, a lot of the things that I think that our department touches every day. I think that I think you cannot divorce what's happening right now in 2020 from what happened in 1940 or in 1970 or in 1837 when Michigan was founded. So I think that there has to be that kind of step back. And I think that that's been kind of the balance of the last 4 months for me, because obviously there are a lot of pressing, when we talk about our Safe and Secure Work Group, which is about basic needs, things that certainly Gilda and Nancy are dealing with every day. That's a part of our mission, but we also have to keep an eye on that long range anti-poverty agenda and those policy initiatives that we think will really kind of help move the needle for long-term results, in addition to using the experiences of this crisis to illustrate why those changes are necessary. So I think that that's how I've tried to organize my thinking over the last 4 months with my 6 months of experience in this job. Obviously, I'm still, almost just learning just when I learned where the bathrooms were, I got sent home. But I am certainly very focused on staying the course for coming up with those long-term solutions, but also using the lessons of COVID-19 to help illustrate them and help people who might have been opposed to some of those long-term strategies that we're hoping to institute really see the actual real-life consequences of those kind of policy decisions. And so that's kind of where I am now.
Yeah. Thank you, Kim.
Mhm.
And congratulations on your new role. Happy to hear that you're serving in that capacity with Leo.
Thank you.
Gilda?
So, wow. So first of all, let me say that this administration is so committed to trying to figure out how to move the needle on poverty. No other, I mean, I've been active in government and politics and policy for decades now, and I've not seen any other administration so dedicated to this kind of work. So I really have to give kudos to the governor, to those department heads who are coming together to figure this out and to integrate policy at every single level. Because you just don't make a change, at the Department of Health and Human Services if you're not going to make a change elsewhere in policy. And again, the Alice report that United Way is doing is like so awesome because it really does help frame things for policymakers, communities, foundations. Everything except for direct services right now to and even that, everything that is going on right now as a result of COVID is policy related. You cannot separate it, period. So, the league's been talking about this, on street corners for years. But the fact is, I think people are really waking up to saying if we're really going to have change, if we're really going to have systemic change, we're really going to not just approach COVID, but public health in general and other kinds of things, that this has to be done in a very measured way, with some very specific goals in mind. I am confident that the recommendations that are going to come out of the Poverty Task Force are not going to go into a file and into a drawer. Trust me, in all the years I've been involved, I sat on commissions for months and come up with recommendations, and nobody ever they never see the light of day. We're not at that point. We all know, Democrats and Republicans together know, we have to make some really important changes right now. How we all do that at the end of the day is obviously sometimes a question. From a personal standpoint, let me just share a little personal part of my life. So for the last year, my husband was very ill. We had home health care workers in our home for about a year, 24/7. I got a chance to meet and become friends with and talk to and understand how amazing these people are who are choosing this as a profession, because in a career it is not easy work. But understanding the need to juggle what often is not, the highest income. They're not making the highest wage. Some are driving without car insurance because they can't afford their insurance. Somebody, was driving without a driver's license because he couldn't afford to pay off of his tickets. Some trying to juggle, going to nursing school and working and family and transportation. I was seeing up close and personal all the stuff that academically, I sit back from a policy standpoint and we write about. I'm telling you, I saw this up close and personal in terms of what is going on. We really need to change how we do things to help low-wage workers become higher-wage workers, to be able to afford to take care of themselves and their families. So, for me, it was somewhat of a reboot, if you will, in terms of how I can start talking about these things a little bit differently and a little more personally. But the fact is, we shouldn't be continuing to have to deal with these same issues year after year after year. We know how to change them. We have to have the political will to do it.
Yeah, thank you, Gilda. I had that same experience over the past 2 years, and seeing it firsthand, just in terms of the supports that they're providing to our family members and friends, and the harsh reality of the low wages that they're making while doing it. So it's definitely an important change that we need sometime soon. So I have one more question for the entire panel. So we don't know yet what the post-COVID-19 economy is going to look like. We do know there will be a lot of Michigan residents who will not be returning to the jobs that they had before COVID hit. So Michigan Works is poised and ready to assist both job seekers and employers as the economy recovers. How do you see us working together to help break down the barriers that we've been discussing this morning? And let's go with the same order. If you want to start us off, Nancy.
Love to. First, I would just say thank you for this. Gilda, it was this time last year that we visited all of this, and oh my goodness, who would have imagined the heightened need for what we're talking about here right now. So first of all, I would just say, let's just tighten these relationships and continue to do what we can do together. I think that the Poverty Task Force and this focus around systems making big shifts, I would say that, our part is a small slice of what needs to happen. But like Michigan Works, we are in every community. There's a real appetite for working collaboratively. And so I would just say we need to up our game around integrated solutions and really working through this equity lens in order to strategically advance the state. I echo Gilda's enthusiasm for the administration. I wake up grateful every morning that we have who we have at the helm in terms of making decisions and getting through COVID. So we're going to be okay, and great partnership here. Just we need to up our game on the integration.
Yep. Thank you, Nancy. Kim?
I think Michigan Works is probably one of the most important partners that we'll have in our work for the Poverty Task Force, because certainly, a big chunk of what I'm doing in kind of both in addition to and with the Poverty Task Force is around helping our workforce become better trained and better prepared so that they can be recession proof, so that they can be machine proof, so that they can live with dignity and make a good living. I mean, we really believe in, I have this funny title of Deputy Director for Prosperity, and I take that seriously. I think prosperity is a noble goal. I don't think that we have framed it like that in the past. I think that in the past, a lot of our work has just been, we have framed it with this idea that it's about just getting work, just getting jobs. But I think we want to get more and better jobs, jobs that pay people a living where they can comfortably have their kids be educated and have their homes be livable and have transportation so they can go to jobs that they enjoy. And so I really take that seriously. And I think Michigan Works and your mission, what you do every day, is really very much aligned with that work. And so I think that to the extent that I will continue to, I have interface with Michigan Works a fair amount in this job, and I think it'll be even more as we really solidify the ideas that we want to present to the governor, because you have that practical experience working with people every day. And so I would hope that, I'm going to put my personal email in the chat. If you have ideas, if you want to take a look at some of the ideas that we already have on the agenda, we'd love to have a conversation with your members because we think that you're a critical partner. Thanks.
Perfect. Thank you, Kim.
Mm-hmm. And so on my wish list is that we could get all of our members of the legislature to use a racial equity lens in their work, in the bills that and the laws that get passed in our state. Quite honestly, that hasn't been done. It hasn't been a priority for the entire legislature. For some folks, it has been. And, you know, I am hopeful that during this turbulent time, that there is some hope that people will be able to look at things differently. But I think we have to work really hard to not just have our advocacy partners take the 21-day challenge. I'd like the entire legislature and their staff to take the 21-day challenge. To really look introspectively and then really use that as a lens to work through policy. And unfortunately, so much of this has become political or partisan, and it should not be that way at all. So that would be, you know, something that I would really want to work on in the short term and in the long term to build a stronger state.
Yeah, thank you, Gilda. And I'll just note to everyone, if you look in the chat, there is a link to the 21-day racial equity challenge. So thank you for putting that up, Steph. So that's all that we have for questions this morning. I want to thank our panels for their leadership, their time, their knowledge, and sharing their thoughts with us this morning. Michigan Works is proud to work with you to assist with breaking down barriers, helping get Michigan residents reemployed post-COVID, and finding employers the talent that they need to re-engage as the economy recovers. So thank you to everyone for joining us this morning. Please consider joining us for the next virtual panel discussion next Monday, August 10th, where we'll be talking with state lawmakers and representatives from Governor Whitmer's office. So have a great day, everyone, and thank you again.